rolling, and I just won't stop. So.
Okay, all right.
And I'm also going to be taking behind the scenes photos. Just don't look at me, just keep straight at the camera.
All right, Dr. Chu, first of all, thank you so much for doing this for us. We really appreciate it. Okay, so first off, if you could please list your name and your role here at Riverside.
I am Dr. Edward Chu. I am the Cardiovascular Pulmonary Critical Care Service Line Chief.
Fantastic. Can you describe to us the type of medical care and procedures you provide?
I am an interventional cardiologist, and I place balloons and stents to open up blocked arteries to include patients who are having a heart attack. I put in pacemakers, and I'm a general cardiologist too.
Awesome. Specifically, can you go into how you use these brand new spaces here at Riverside, the electrophysiology lab and the interventional radiology lab?
Riverside is undergoing a redesign of its interventional laboratories. Currently we have 5. The electrophysiology lab that you see right here is one of our newest additions. It is one of only a few labs in this region that can perform electrophysiology, and the only pure electrophysiology lab on the peninsula. We have an interventional radiology lab, also new, and this allows our new vascular surgeons, our old vascular surgeons for that matter, to perform new techniques in managing peripheral and aortic disease. These patients are incredibly sick, and they provide services that we don't provide anywhere else on the peninsula. The redesign has 2 additional catheterization laboratories that we have in place. These are the cardiac catheterization laboratories, and they will be performed or constructed over the next 2 years. We have a neurointerventional lab that we have now for 5 years, and it will probably be ready for the last redesign phase, which will be in approximately 3 to 4 years.
Just a little higher on the volume if
Oh,
you can.
okay.
Just a
Yep.
little bit.
Yep.
No worries.
Okay, so you spoke to whether or not they were readily available in the region. Can you touch a little bit on how this really is cutting edge care within the cardiology industry, or service line, excuse me?
So our cardiovascular services here at Riverside represent one of the standard bearers for cardiovascular care in our region. We here in the electrophysiology lab treat complex arrhythmias, everything from the most common arrhythmia, atrial fibrillation, where ablations are performed here, to life-threatening arrhythmias such as ventricular tachycardias and other rapid heart rhythms that can influence survival, as well as whether or not patients have bad outcomes such as passing out. Pacemakers, defibrillators, and left ventricular, we should probably redo that.
Yeah.
Always after the door shuts. that microphone picks up everything. Sorry. Do we want
It
to?
sounded so good.
I know.
I'll just start again.
Okay.
Good. Thank
No
you.
Thank you. Sorry.
Okay, no worries.
Do you want me to ask you the question again?
Yeah, ask me the question.
Okay, all right. Can you tell us a little bit more about how the care that we provide here is cutting edge in the cardiology service line and for our communities?
So Riverside has our cardiovascular services, one of the standard bearers of cardiovascular care, certainly in our community. We provide a care to include management of acute heart attack and acute stroke. Here in the electrophysiology lab, we take care of patients with even common arrhythmias such as atrial fibrillation, and ablations can be performed, to life-threatening arrhythmias such as ventricular tachycardia, and common arrhythmias such as other rapid heart rhythms, supraventricular tachycardia, where patients can suffer bad outcomes to include passing out. We implant defibrillators here. These are life-saving devices, and really designed for a laboratory like this. Our interventional radiology suite allows us to perform complex arterial and aortic disease management strategies where we can perform them with catheters and without surgery. Our catheterization laboratories, which will be rebuilt over the coming years, provide the care of patients who have acute heart attacks as well as common symptoms of coronary artery disease.
Awesome.
I would have mentioned the neurointerventional lab actually.
Yeah, that would be lovely.
Did it go off?
Well, I'm just giving it a tap.
So our neurointerventional suite is where we perform acute stroke management. So patients who come in with devastating symptoms can come out without much in the way of residual symptoms if they can be intervened on quickly by a highly skilled team.
Awesome. Can you talk a little bit about how you work with them? Maybe like, do you guys collaborate? I know that wasn't one of the questions. I'm also just curious.
So you're talking about the electrophysiologist, interventional radiologist, just kind of globally.
Yeah. So you earlier Cheryl mentioned how like there's the radiologists and then there's it vascular radiologists.
So okay.
Okay.
Yeah.
Is that?
So Riverside is certainly blessed with a highly competent, skilled team of patient-centered physicians, but we also have physicians that don't belong to the Riverside Medical Group, are interventional radiologists, and they're equally skilled. I think that we work very well together, and indeed the crossover between vascular disease, cardiology, and electrophysiology is certainly complex and common.
Awesome. Okay. And then are there any other support programs or pieces of technology that make your work stand out that you'd like to highlight?
So approximately 2 years ago, our team built a hybrid operating room where we perform many of these same procedures in the setting of the operating room. And that is one of the services that we can provide, the only one on the peninsula. Actually the only one in the region except for Norfolk. Where hybrid laboratories have become state of the art. We do structural heart disease in there, placement of the Watchman, the left atrial appendage closure device, lead extractions, which we have ongoing today. We do complex aortic disease there, thoracic endograft and abdominal aortic endograft procedures. It's become really quite interesting that we've evolved with medicine, which is changing daily.
Love it. Okay. And then lastly, what does supporting Riverside Philanthropy mean to you? And do you have a message to those watching from home who continue to support Riverside and the work you do?
So Riverside has always been, and one of the reasons why I am here, a community-centered hospital system. We are here to care for our patients, our families, our neighbors. Quite passionate about that, and in that setting, it is the reason why I support Riverside, outside of working for Riverside. I do believe that cardiovascular disease is the most common killer still in the country, and this is where we take care of those problems.
Fantastic. And would you be willing to say thank you to our donors for all of their support?
And a little loud, just loud.
This just
computer-
kicked on.
The computer kicked in. And
Yeah. So this room has probably as much electronics as 2 of our normal cath labs.
Really?
Yes, and probably 10 times that of the ICU.
Wow.
Now, the energy required just for that unit right there, it's called a biplane fluoroscopy unit, can basically light a neighborhood.
are those generators on the wall?
They are.
That's what I
But, so
thought,
there's a
yeah.
whole room for generators.
Then when I
back there.
saw those, I was like, that must indicate how how much is flowing through this space. Yeah, it's and even if we
I was gonna say, do you want to get him a couple of seconds just kind of explaining
Yeah,
what
our
we're
shot, if you want to see how this looks like from where we are, but if you to see what's in the frame. I mean, I can move.
It's okay.
Yeah,
No,
we
don't
can-
move it. Don't move it. It's okay.
But I can kind of.
Here, let me finish what you
Yeah,
said,
yeah.
before we start moving.
Yeah, before we
on.
start pointing and all that. Go ahead.
So we here at Riverside, our team are a team of physicians, technologists, nurses, respiratory therapists, sonographers. We represent a very, very comprehensive team that really appreciate the support of our community, the foundation in particular. Without it, we really are not as successful. Rooms like this and others like this throughout the facility really are where we deliver our care. This is the tip of the spear, if you must. But this is actually where the action happens. So when you come in with your heart attack or stroke, we'll be ready, and we appreciate your support.
That was beautiful.
Yeah, I think so.
So articulate.
Because I'm not gonna touch that bad boy, but I mean,
Well,
if
we can scooch just,
Yeah.
Yeah,
I can
so,
if I go out a little,
yeah,
which
go out a little.
which just means that you might just need to be a little,
Okay.
a little louder.
Okay.
But
So I actually have a pretty muted voice.
well, you start out high, and then as you go, each time you kind of went down like a little bit.
It's
Okay.
when you relax into what you're talking about
Right,
that happens
right,
a little
right.
bit. Yeah.
Yeah, and people like Allison and I are loud all the time. So you always hear us.
Which some might think is annoying, but
But so right now I've got everything. I mean, does the front of it swing around
It
easily for a better look at it?
Also, Dr. Chu, are you okay on time? It's 2:04, and we want to be
I
respectful.
have a meeting at 2:30.
Okay. Yeah, we'll be
We
good
just
and
want to
done
be
by then.
respectful of your time.
So that, yeah.
Yeah, so let's see, we don't want the table, we don't want the gantry. Let's move. That's like that. Everything is like
Okay.
Okay.
yeah, but they have it like that intentionally.
And I'm backed up a little bit so you can see where.
We're trying to move the lateral out.
And if I have it turned like this, it just means you might want to go a little cool.
Do it cheek way.
Cup underneath
Maybe here.
Is that enough or a little more? Backwards.
Like, is there a like that where it says Siemens across the front of it? Is there any way for that to be facing the camera?
Or does that do that?
Oh, I see. No, that I can rotate.
Siemens also happens to be a big donor, so it all works out perfectly.
No, actually, so I want to rotate the whole camera, right?
Is that what that is a camera?
Yeah. So it's actually not a camera, and it's actually a detector plate and something that emits high energy electrons.
Gotcha.
Now, so is it that one? Yeah, because we want to swivel it, right? But you can swivel it.
Yeah, you can swivel it where you want.
Let's just swivel it.
Yeah, it's gonna be a full shot. I was gonna be barbaric and just go over there and move it.
Siemens is a big foundation brand.
Huh?
Okay, did I just unlock it and not swivel?
I'm not sure.
Yeah, Siemens always does true lights. And other things too.
Yes, ma'am.
Hey, I talked to the team. They said the eye is not big enough,
Okay,
so the physician would not want it.
okay, so we're just gonna have to pay you overtime?
Yep.
Okay. Fine.
Okay.
Let's see.
I thought when you unlocked it, you could swivel it.
I thought I did, but for some reason it didn't. It must be.
We don't want to cause too much trouble.
Yeah.
Well, it's meant to swivel all the way over the
Right,
yeah.
So, unfortunately, none of us work routinely.
Yeah, we don't.
Is it because that big piece in the back isn't moved forward? Does it not?
No, it's designed to go move in tandem. That actually slides on rails on the ceiling.
There you go. That's cool.
Is that good enough?
Yep, perfect.
Cool. And you're gonna have to stand on the other side still?
Yeah, I still think if you're back where you were, but so you can see this shot to see.
Siemens?
I can move, so it's
No, that's fine.
like I can roll is what I mean. So if you do start to kind of go out of bounds, then I'll follow you. But as close into that crevice, yeah, right there, that's great.
Is that enough stuff on your screen?
Yeah.
Yep,
I think
perfect.
that's good. Yeah.
Thank
awesome.
you.
This is great.
And we never stopped rolling, so I guess we have all that on.
We're gonna have to
So what we have here is called biplane fluoroscopy, and this allows us to bring two sets of images.
Choose your mask.
All right, yeah, because
And with the
I'm
door?
pretty muted. Thank you.
Yeah, and when when we
And
shut
the door, yeah, we'll wait for the door.
So what we have behind us here is called biplane fluoroscopy. This is where we allow two sets of images to be performed simultaneously, where we can image the heart in a plane like this, as well as a plane like this. And so the physician does not need to move the camera or the patient. And in this setting, we can actually perform more complex procedures more efficiently.
Perfect.
Awesome.
All
Yeah,
right.
that's so
And
great.
will you put your mask back on and appease us for a selfie as we do? This is customary. You just have to wait.
Okay.
So everybody hands up and wave. Perfect. Thank you.
Thank you so much, Dr. Chu. You're a lot of fun.
Okay, well, great. Thank you.
All right, we'll
So
get
I
all
was
of
involved in getting the bond for this upgrade.
Wow. I mean, it takes a lot of players,
Yeah,
right?
so the process to upgrade the cath lab started probably about 3 years ago. The process to build a hybrid arm, which required a separate bond, that started in 2013.
Wow.
Did you have to promise that you wouldn't leave? You know, did people did certain people who say, I promise I won't go anywhere if you get this?
No, that's not the case. I mean,
Well, we know it takes a lot. You know, making the business case for this stuff takes so many
Yeah.
people.
so,
Yeah.
I was going to let you guys pack up.
Yep.
Yes,
Perfect.
thank you. Yep, you got that. And we can roll out past